For me, from a younger age, I actually wanted to be a doctor. And then I started to look at medicine and dentistry and comparing both. And I realized that dentistry.
Why do you think that art is essential?
I think having a background in doing things with your hands and doing arts actually helps when you're working with a tooth and carving a tooth. So art and manual dexterity are really, really important in dentistry. Life as a doctor, I felt, was quite intense and grueling, and I felt that dentistry was a better fit for me.
I'm assuming that you have more time to spend with your family and kids.
Absolutely. That was probably one of the leading reasons why I wanted to set up by myself. I want to be around for my kids.
Choosing one career doesn't mean it has to be your final destination. Today, on Unblur the Path, we are speaking to someone who spent over 15 years in dentistry, one of the most respected and demanding professions, before making a bold shift into aesthetic medicine. This is Bansri's story, honest, practical, and full of perspective. Stay with us if you want a clear, real-world view of a career in dentistry and what it takes to transition into aesthetic medicine. Hi, Bansri. Welcome to Unblur the Path. I hope you're having a good day today.
Hi, really happy to be here today.
I am excited to know about your journey because it's a different field. For our listeners, you'll really enjoy this conversation, and let's talk to Bansri and know where she is right now and what has been her background and how she came to where she is right now. So Bansri, over to you.
So I am a dentist. I qualified in 2008, but now I am working full-time in aesthetic medicine as an aesthetic practitioner. So I have actually left the dental field. So today I'll be talking about both. I'm going to be speaking about dentistry and I'm going to be speaking about aesthetic medicine.
Lovely, Bansri. It's amazing that you have two fields to share with us. So let me take you back in time where you thought a dentistry was the profession you're looking up to. Maybe it was early teens, maybe it was mid-teens. So whenever it was, how did you think that you want to be a dentist?
So I always knew that I wanted to work in a patient-facing job. For me, from a younger age, I actually wanted to be a doctor. And then I started to look at medicine and dentistry and comparing both. I realized that dentistry was more clinical. It was more to do with manual dexterity. And I felt that that was the right career path for me.
Okay. And when was it that you thought that, this is what you want to do, this is where you want to be, like a patient-facing job?
Probably when I was doing my GCSEs.
Okay.
So that's when we started getting career guidance at school and speaking about careers. And that was the pivotal moment for me deciding dentistry was the right way forward for me.
Okay. And was it that you were good in any subjects that prompted you that, okay, this is where I'm strong, so maybe let me think about dentistry because this would help me?
So definitely biology and chemistry were my strong points, and art as well. And actually art is super important as a dentist.
Okay.
And it's so yeah, definitely those three subjects were my strongest and were really important in choosing dentistry.
Okay. So I am assuming that you took these subjects in your GCSE.
Yes, I did.
Okay. And just to understand the GCSE and A levels, how does these subjects transition into A levels? Do you continue with them or do you add, reduce? How does it work?
So I continued with biology and chemistry. And when I was doing my UCAS applications and looking at dental schools, you needed to have two sciences to be able to go into dental school. I think it was biology as a pre-requirement, and I think chemistry or physics, but two out of the three science subjects was a necessity. Arts I didn't continue with, but I just had lots of art experience that I gathered with doing my A levels.
Okay. And why do you think that art is essential in GCSE? Like you said, it helps. How do you think it helps?
I think having a background in doing things with your hands and doing arts actually helps when you're working with a tooth and carving a tooth. So, arts and manual dexterity are really, really important in dentistry.
That's a very important point. Like I wouldn't have thought that art would be something which is related, but then when you talk about manual dexterity, it does make a lot of sense that the attention to detail and the precision with your hands is what.
In the dental interview, I was actually asked no academic questions. It
Okay.
was all what kind of things that I could show them for my dexterity. So, pieces of artwork, things that you've made at home, mending, anything that you've done, they visually wanted to see it.
Wow.
So they wanted to see that you were able to work in a very confined space and show what you could do with, with a tooth or going forward, how you could work with your hands.
Wow, that's amazing. So from A levels, like when you were applying in your A levels for universities, can you explain the process? Because that's going to be handy to many students who are going to listen to this.
So you decide on what you want to do. And I had to fill out a UCAS form. And alongside the UCAS form, something called a personal statement, where you're describing why you would be a good fit for a dental school. So the process involved, gathering pieces of art, obviously maintaining your grades, and also just doing work experience in a dental practice so that you could make sure that that was the right career path for you to get all your experiences down in this one letter that you're writing to the universities, your personal statement.
Okay. So when you mentioned work experience, did you only do dentistry work experience or did you also explore a couple of more
So
careers?
I actually also did some work experience in a hospital, and I also worked in a dental practice. And then I looked at both and saw life as a doctor, I felt was quite intense and grueling. And I felt that dentistry was a better fit for me and what I wanted for the future.
Okay, great. So, Bansri, after your A levels, did you join the college that you wanted to, or what was your next step after that?
So when I finished my A levels, I dropped a grade in biology. And as a result of this, I didn't actually get to start university straight away. There were two universities that were my top two that I was looking to go to. And one of the universities said that they would offer me medicine or pharmacy that same year. And the other university said that they would give me deferred entry in a year's time to start dental school. So at this point, I had no idea which way I wanted to go. I went on holiday and started to think about whether I wanted to go back into medicine, which was always my first thought, or whether I wanted to stick to dental school. And I spoke to my family and my brother and decided that I wanted to continue with dental school and take a gap year.
There must be emotions because you did not take the first opportunity to get onto one university. How did you deal with those emotions during that gap year? And then finally went and did the dentistry that you wanted to do?
So I found it very difficult to start with, seeing my friends who were all like super smart going on to universities and starting the next phase in their life, and me kind of having to hold back a little bit until it was the right time for me. So initially, I think I struggled with that kind of mental movement of what was going to happen next. I went on a holiday, came back and I started working in retail on Oxford Street, and I love to shop as most women do. So I kind of picked myself up and just remembered what it was that I wanted to do, and realized that this was a year that was going to go really quickly. And I knew that I had a date to start dental school. So I used the year to work, to earn money, to spend time with my friends who were already at university, and just grow as a person so that I was ready for dental school.
And that really makes a lot of sense.
One of the biggest things I think I learned early on in life is never let a setback hold you back.
Yeah.
I've still achieved everything that I have wanted, and probably more, because I am now super determined to not let that define me. So yeah, to not let anything stop you if you do have a setback.
Yeah. So any listeners who are relating to this particular emotion should definitely take a look into how to pull yourselves again and do what's best for you at that point in time, and then remember your goal and keep your eye on the goal and work towards it. So
Absolutely.
that's what I'm taking away from what you just said, and that's brilliantly put, Bansri.
Yeah.
How was university like? How was it?
Amazing. So definitely it was grueling because you don't have very many holidays. The way that dentistry is structured, it doesn't really allow you to have a lot of time off, but definitely some of the best years with my best friends. And the course itself is divided into 5. The first 2 years is a lot of theory base, and from year 3 onwards, you are working in a hospital, in a clinical environment, treating patients, but working, under, a tutor who's guiding you through the final 3 years.
Okay. And this is a 5-year course.
Yes, it is.
Okay. Okay. So were you a boarder?
So I was a mix. In first, third, and fourth, I lived at university. Even though I live in London and the university, so I went to Queen Mary's, and that's also in London.
Right.
The experience of living out in London was unmatched. I learned so much about money and friends, and also the social aspect was amazing. So I did 3 years living in halls or another accommodation, and I did 2 years living at home.
Okay. So what did you learn? What skills did you develop when you were staying away from your parents during this phase?
How to manage money, I
Huh?
think that's probably the most important. I had a student loan, and then I also, because I had been working in my gap year, I had some money that I had saved. But the main thing was, working at in your halls, learning how to be independent away from your parents, studying without, having someone come to bring you food, just working through all the smaller things,
Yeah.
a food shop, getting to lectures, getting the work done. It was a whole new level of independence.
Okay. I would urge you to speak a little bit more about the whole dentistry course, like, from the perspective of how subjects were introduced to you, how practicals were introduced to you, and then how did you transition into working with the real patients, like you mentioned earlier. So, how were you guided to do this? Because it's from a perspective of explaining to our young listeners and their parents that how the 5 years of dentistry course looks like from someone who's actually done it.
So the first 2 years was theory. You're learning physiology, you're learning about material sciences, you're learning about anatomy, you're learning about human health and disease. So the entire second year was human health and disease. You're learning about every kind of medical condition, diseases, because they have an interaction with dentistry as well. From third year onwards, you are split into different groups and you have a clinical partner and you work alongside your clinical partner. You start seeing a patient a day, which turns into two patients a day. So that means, a 3 hour slot for one patient. And every step, so if you're learning how to do a filling, then there are like lots of different steps along that journey. You start making, you start numbing the patient, you make a little cavity, and you're working with the tutor. So after every single stage, you go to the tutor and you ask him or her to come and check your work. So the whole process might not take 3 hours, but the 3 hours is with the to and froing with your tutor. And then you start to become a bit more confident. So as the years pass, you might not have to check every stage with your tutor. You might have to check maybe 3 or 4 stages and, show them the final result.
Okay.
So, and that's from year 3 to year 5, you are seeing you've seen quite a lot of patients throughout that journey. So then it gives you all the confidence that you need to move forward with dentistry in the real world.
Okay. Okay. That's quite a practical experience that you start acquiring in college. So, if you look at your 5 years journey, what was the most exciting part and what was the most challenging part for you?
So the most challenging, I would say, is there is clinical sign-offs. So a clinical sign-off is in year 3, you have to do 15 fillings. And only when the filling has been done to a very good standard would your tutor sign it off. So from year 3 to year 5, you had clinical sign off. So I remember that being a bit stressful because you had to make sure that that was done before you qualify. I guess, the best part of university was the social aspect, going into university with your friends in lectures, going out in the evening to dinners and bars and clubs. It is an experience that you can't get back once you move forward in life.
I totally agree with it. That's probably the most important part of being in college, the social life that you learn to enjoy and thrive in as well.
Yeah.
Yeah. Okay. So, moving on from your college life to how do you land your first work experience? Like you did mention that you had some work experience in your gap year, but once you're done with your university, what's your next step? Do you get into job or do you go for masters? How
So you complete dental school, and at the end of dental school, you have your Bachelor of Dental Science. However, within the UK, you also need to do something called vocational training. And vocational training is working either in a hospital environment or a dental clinical practice under the guidance of a vocational trainer. So it's a year of training where you are working independently in your own clinical room, your own surgery, but you have full guidance of your vocational trainer. So that process was also an application form. So very similar to university and having the UCAS and personal statement. It was very similar to that, where you apply to a group of practices called a deanery. And from that point, you get accepted into a deanery, and then within a deanery there's usually about 12 practices. So I applied to a deanery that was close to my house because it had like 4 or 5 practices that were commutable distance for me, and then you rank the practices and then you get allocated a practice.
Okay. So, sorry, go on.
Not all dental practices have a vocational trainer, so you can't apply to any. It has to be ones within the deanery.
Okay. And so, at what time do you start applying? Is it like after completion or just a year before? What is the timeline when you start?
So I remember coming into the end of dentistry in the final year, and I think you finish in like May.
Mm-hmm.
You had June, July, August to apply. So a few months, not a great amount of time. but enough because everyone around the country is all doing it at this point in time. So a few months, you have to get your registration number. You also have to get your vocational trainee number. So that whole process, a few months, and then you're allocated a practice. You finish dental school in May, June, and you start vocational training in September.
Okay.
Yeah.
Once you start applying, how soon do you hear back? Like, is it a long wait, or is it
No,
something?
I don't really remember it being a long way at all. I think maybe a month or 6 weeks before you found out what you have been allocated.
Yeah.
And then you decide whether, and there wasn't very much room to change that position. You had to just accept what you were given.
Okay. It does make sense in a way that, you're just trying to learn the craft in a professional setting.
Absolutely.
So,
Yes,
so
absolutely.
how was your vocational training like? How did it go? What were the learnings? What were the challenges? If you can speak about that.
Vocational training was amazing. Firstly, you've been at dental school for 5 years and finally you have some money coming in. Financially, although it was a basic salary, you start earning some money.
Yeah.
You also get the clinical freedom. So you've got your own room. And where at dental school, every single step is looked at by a tutor.
Yeah.
Now you're very much clinically independent,
Right.
making your own decisions, learning how to work with a dental nurse, learning how to write your own notes, working out, your own challenges. If there is a patient who is anxious or a child who doesn't want to sit in the chair, if there's nobody to fall back on, it's you. So
Yes.
I learned so much in that. Yeah, in dental school, you may have seen maybe 2 patients a day. In vocational training, you start upping the pace and you maybe see 10 patients a day. So the confidence that I have, maintained and got as a dentist has come from that vocational training and working closely with scenarios and complications and rewards, the whole thing, but working with your vocational trainer who is also there to guide you, but not if you don't feel that you need the support.
Okay. So, if I take you back one step, in the dental school, were you taught these softer skills as well? How to handle difficult patients, anxious patients? How do you handle them? And are you trained for that, or is it on the job?
You learn on the job. You do learn some theory behind empathy and communication skills and all the things that make you a good dentist away from the practical side. The majority of those skills come from seeing patients, doing your day to day work, having a difficult patient, having something that doesn't work and having to explain that. But yes, very much so. You learn on the job. And as a vocational trainee, I learned I learned so much about the softer skills.
That's brilliant. Moving on to your next phase, like once you're done with your vocational training, what's next?
So then at the end of that vocational training year, you get something called a performer number. And that means you can apply to any practice in the UK. So actually, I didn't struggle in that transition. As I was already working in a dental practice, my next step, just because I had an interest in maxillofacial. So maxillofacial is anything to do with the head and neck, but it's looking at things away from clinical dentistry. So it's fractures, so fractured mandibles, it's salivary gland swellings, it's head and neck cancers, it's wisdom teeth extraction. So I applied to work in a hospital and I did 1 year of hospital training. Now, that 1 year of hospital training is really important if you, in the future, at some point, want to specialize in a field of dentistry. So, if you want to go into orthodontics, which is braces, if you want to go into pediatrics, which is looking after children, if you want to go into prosthodontics, which is looking at, the loss of teeth and crowns and dentures, you need to have done a year of foundation training in hospital. So for me, it was the right time to go into hospital to do that 1 year, and just, it's everything that you would expect from dentistry, but so much more because you're looking at the full face and neck.
Okay. Okay.
So I did a year of training in hospital. And at the end of that year, I decided that I wanted to go into a dental practice and
Mhm.
applied into a dental practice and started working in practice.
Okay. So when you were in the hospital, this was your work phase. You started earning after your vocational training, like while your vocational training in the work space in the hospital, and then the next dental practice that you applied into.
Yeah.
It started your work life, right?
Yes.
So, like you have already mentioned, the transition was not very difficult because you were already doing a lot of work in the vocational training. So, transition to the hospital, was it different or was it not very different?
Was very different. Where in a clinical setting, you're seeing 10 patients, and your nurse brings you a tea and you get to have a lunch break and you're very much in control.
Mm.
Hospital setting, you're very much not in control. You're working under two consultants. It was a really, really challenging year. It was on call, and you had to deal with a variety of different clinics. There
Mm.
could be an oral surgery clinic, and then there could be theatre where you're going into theatre and you're assisting your surgeon. The variety of work and the variety of medical scenarios that you're faced with was massive, but it was a very different environment. It was super challenging.
And were you exposed to these kind of surgeries when you were in the dentistry?
Not at all. Very much are learning from the beginning, learning step by step, seeing somebody in A&E who might have a fractured mandible. So this is a mandible.
Mhm.
Fractured mandible is when this is broken somewhere. So if someone has come into A&E with a fractured mandible, you very much learn while you're treating. You speak to the consultant, and the consultants help you work out a treatment plan, how to deal with that patient. But it was not dentistry. I didn't learn much about dentistry in that year. It was everything other than dentistry, head and neck related.
Okay. And so, what made you come back to dental practice again?
So I struggled that year. I
Mm.
found it really difficult. I lost weight because you need 1,000 steps, and it was very, very difficult to work in a hospital. And I mentioned at the start that for me, it was a decision between medicine and dentistry. And at that point, working in hospital and seeing how difficult it is, I realized that dentistry was the right career choice for me. And that year kind of almost gave me the affirmation that I needed. I think maybe I took that position in hospital because I wanted to explore the hospital clinical setting side of dentistry. And once I had completed that, I
Mhm.
was very fixed that I wanted to work in my own clinical independent setting.
Okay. So, the takeaway from this is if you have doubts about what you want to do, you better take a plunge and,
And put yourself, and there's no harm in putting yourself into the unknown
yeah,
and then realizing that it's not the right career for you.
yeah,
When you're in dental school and you have only learnt about teeth, learning to be a good doctor of teeth,
yeah, yeah.
you almost feel a bit trapped. And for me, this was my chance to explore and see if the other side of dentistry, or what my degree allowed me to be exposed to, was a better fit for me.
Right. It's such a brilliant way to explore things and then make your very informed decision rather than just assuming that this is what is going to happen. This, from hearsay. It's
Yeah.
better to always experience and make best decisions after that.
Yeah.
So once you're back in the dental practice, of course, this was your zone. You enjoyed it before getting into this hospital. How long did you spend in the dental practice?
So I qualified in 2008, and nine, I completed vocational training 2010 in August, I started working in a dental practice, and I have been working in a dental practice up until 2023. I've always worked in two separate dental clinics. I liked the fact that it made my weeks go quicker and I had different staff and different patients and different demographics. I've never worked full time in one dental practice.
Okay.
Always worked in two. While I had my children, I took maternity leave twice. And it was in 2023 that I decided to leave dentistry.
Okay. We'll come to how and why you decided. Before that, I would like you to elaborate a little bit about your experience in the various dental practices. And of course, like you mentioned, motherhood came along the way. So, how was it balancing your work and your personal priorities throughout this whole process?
So, working in a dental practice was great. Each dental practice may have different patient demographics.
Mhm.
Be an affluent area. So, in those areas, the type of dentistry would be different to an area that is deprived, a socially deprived area. In socially deprived areas, you might be treating lots of decay and doing lots of restorative work. And in an affluent area, you might just be doing, things like a cracked tooth or lots of checkups. So I worked in various different dental practices in different areas just to give me that confidence. In the socially deprived areas is where you are going to really get the skills that you need to be a really good dentist. And in the affluent areas, life is a little bit more relaxed because you might not be describing decay or gum disease to all of your patients because they are very educated. So I have always worked in different areas, and even in a practice that isn't socially deprived and is an affluent area, if you're doing something called a crown, which is basically a little cap for a tooth, you get more experience in crowns because those patients are the ones that may not have decay but have got other issues with their teeth for other reasons. So you have a variety of different dentistry. When I had my children, I took a break from dentistry. And because I think one of the reasons that I loved dentistry was the flexibility that I could work 4 days. I could cut down and do 2 days at two different practices. I had that freedom that if something in life was telling me to slow down, I physically could. And it was a great career choice in that aspect. When I had my children, I took a full year off with both my children. And then every time I went back to work after a child, I reduced a day. So
Okay.
after my first child, I was maybe doing 3.5 days. And then after my second child, I was doing 2 to 3 days. So that freedom allowed me to be available for my children. And if they were having long days at nursery, it would only be maybe 2 long days at nursery, and I would be around the rest of the days. So I loved that I have been able to grow
Mhm.
with my kids.
That's wonderful that it provides you that flexibility. It helps you maintain your work-life balance, and that's rare in many professions. But I'm happy to hear that dentistry provides you with that.
Yeah.
One important aspect of any profession is the remuneration, the salary. Don't have to divulge any numbers, but do you think it's sufficient to, if you were not married, say, as a single, had you progressed 10 years into dentistry, was it sufficient to take care of yourself?
Absolutely.
Yeah. Okay. That's what I want to understand, because any profession we do for passion and love for the subject, or the way we look at a particular profession. But a very, very, and one of the most important part of any profession is, of course, the salary, the money that it brings on the table. So, well, if you say that it takes care
And
of you, that's wonderful.
if you are a relaxed dentist and you just want to do, um, routine dentistry, so that's general practice,
Yeah.
you can stick to that field. If you want to earn more money and you want to progress and widen your horizons, you can move into implants, you can do gum surgery, you can do teeth straightening, and you can boost your income with the field of practice that you think you'd be good at.
Well, that makes a lot of sense. So there are multiple fields that you can get into and enhance.
And you can grow, and most dentists that I know have all progressed into dentistry and done general practice, but done a few other little things along the way to make them, give them a special interest in that particular field.
So again, the most important part I always want to understand at any phase of your life is what was the challenge, if there were any, during this 10 to 12 years of your dentistry practice?
The most challenging parts of dentistry, I would say, is having to look after anxious patients. So a patient who comes through the door and knows that they need treatment and cannot sit in the chair, cannot have the local anesthetic, cannot actually have a physical drill in their mouths. Dealing with anxious patients, I think, is the most challenging. And
Mhm.
knowing how to get them to the end goal that they need without potentially having to refer for sedation. So sedation is when you're consciously kind of a bit groggy and half asleep,
Mhm.
the procedure done. And although that's an option, it's not always the best option if somebody needs multiple fillings and root canals and extractions. So dealing with anxious patients has definitely been the biggest challenge.
And what was your most rewarding part during this phase?
I would say the flip side of that, particularly children. We liked working with children, but I could see that it's also anxious for a child to sit in the chair and have a filling done,
Yeah.
but super rewarding when they've sat through a procedure and, they're holding on to their mum or their chair. And, I've seen more bravery in children than I have in adults. Quite often that would bring a tear to my eye. Yeah.
That's
So
beautiful.
definitely working with children. And at one stage, I kind of did feel that maybe pediatric dentistry was a way forward for me, but I didn't pursue it.
Okay. Okay. So in 2023, you said that you made a change. Now, what made you think that, okay, I'm done with dentistry, or probably this is no more for me? I have to move to something else. What made you think that? And let's talk about that.
So I tried in 2008
Mhm.
and I left in 2023. So in that time, even with my mat leave in between, I felt like I had done a lot of dentistry. And where most other degrees, let's say finance, you're able to work in one field and then transition into another role and learn something else. Dentistry is very similar whether you do it in 2008 or whether I did it in 2023. In 2011, I started some training with a couple of friends in aesthetic medicine. So what aesthetic medicine is, it's not really a side of dentistry. It's actually more to do with head and neck. It's injectable treatments, it's skin boosters, it's chemical peels, it's treatments that can physically give someone a boosted self esteem. I started that training in 2011. And although I was working as a dentist throughout that time, every year I would do a different training course for aesthetic medicine. I started working as an aesthetics practitioner in 2 beauty salons in 2011 and did a little bit of work, away from dentistry. So I had a couple of days in a dental practice and then a couple of days in a beauty salon, and I built up some clients. Through those years, the interest in aesthetic medicine for me was growing. And after I had my second child in 2017, I realized that I wanted to focus on that a little bit more. And in 2019, I set up my own clinic. I have a clinic that used to be within my house, and now I have an outbuilding at the back of my house. So from 2019, I started to build my clients because even that is not easy to start your own business, to build up your clients, to also work as a dentist. And I felt that was working 2 or 3 days as a dentist and 2 or 3 days as an aesthetic practitioner. And I wasn't progressing in both. And I felt that something had to give. Obviously, I had children who, were demanding and needed my time as well. So I felt that I couldn't progress in dentistry and I couldn't progress with more things I wanted to do in aesthetic medicine because I physically didn't have the time. So from 2019, I knew that I would get to a point where I would leave dentistry, but that mentally took time to accept that I was going to be moving into another career and I didn't have a fallback option. I didn't have a fallback income. So from probably around 2021 to 2023, I was doing something called Invisalign. And Invisalign is invisible braces, invisible retainers that you give to patients to straighten their teeth. So I very much enjoyed the aesthetic side of dentistry, visit bonding and Invisalign, white fillings. So this transition to aesthetic medicine seemed quite seamless to me because I was always interested in the beauty. And 2023, I left dentistry. And since then, I have been able to grow my business so much more because 100% of my time and effort is on aesthetic medicine.
Brilliant, brilliant. And kudos for you to doing that because it takes a lot of efforts, mental resilience to, move from one career which you are good at to another career which you're starting to build. So well done for that.
Thank you.
But my question to you here is in 2011, what is it that you thought attracted you to aesthetic medicines?
Actually, I had a patient who was from America, and her dentist in America had done a treatment called Botox to this part of the face to reduce her gummy smile. So a gummy smile is when you smile and you have a lot of tooth or gum showing. So she said that her dentist in America did this treatment for her. So it kind of opened my eyes. I already knew about injectables, but hadn't really thought much about it. And then 2 other friends and myself, we went on a training course, and that's how my aesthetic medicine career started.
Okay. Okay. And how are the courses? Like you said, you did a few courses, almost a course a year when you were starting. So how long are those? What is taught in that? And who is eligible to apply for such courses? What's the prerequisite?
So being a dentist, it opened a lot of doors for me in aesthetics. Courses were readily available. Some courses might be a two-day course. Basic Botox might be a 2-day course. When you start advancing into advanced training courses, then it might be a few extra days. You can do courses over a few days, and because you've got the anatomy and physiology and knowledge behind you, is quite straightforward to get onto those courses, and they're readily available.
And you did all of them in London?
Yes, I did. Yeah.
Okay.
Just trying to think. Yeah, most of them were in London. I would find something that was big in the market and research it, look up, there's lots of different training providers, look up what course I was interested in doing. But generally, they were all very short courses. So very easy, I guess, to increase your portfolio of work. And then you start working and practicing those procedures to become really good at it.
Okay. So this is a very layman question. I see that there are a lot of failed injectables or failed Botox scenarios, which we see online. What is it that is you have to look at before you apply for a course? What areas are you looking at a course provider that will ensure that you are booking your time with the right trainer?
Just making sure that they're credible. Once you start working in the aesthetics industry, you very much know the biggest training providers there are. So all of my training has been with a good, sufficient, well-established training academy because that's where you are going to learn the right way. And all of my training courses have been by a training academy that has a medical background. There are lots of training academies all over the UK, and actually some of them are not from a medical background. But for me, it was my preference to go to someone who would be able to teach me in the most sufficient, in the way that I would need to progress.
Right, right. That's an important information for anyone who's wanting to pursue this, because you can't be trained wrong and then get the right outcomes out of it, because it's to do with self-esteem, like you said, right?
And when you go to, medical professional company, they're going to be teaching you complications. So they're not only going to be teaching you how to treat different concerns, they're also going to be doing complications training of how to deal with something should there be a problem. And that is just as important as learning how to do the procedure.
Okay. So next logical question that I have is, how did you think about setting your own business? It's maybe thinking to set your own business is one part, but executing it is another ballgame altogether. So how did you go about that?
I think it took me a while to get to the point where I wanted my own business. I think being the children kind of, mentally fogged my brain. I felt like I couldn't really think about much until they were out of, they were sleeping through. When I was working in the beauty salon, I hadn't branded myself. So from 2011, for a few years, while I was gaining my experience, it was very much just Dr. Bansri coming into the clinics or coming into the beauty salons. But I hadn't branded. And I think I probably had a bit of a push from my husband, my backbone, and he has really pushed me into not even the unknown, the areas that feel uncomfortable. And he was, one of the reasons why I thought, okay, fine, let me try. I've got nothing to lose and I'm still working as a dentist. Let me do this alongside dentistry. Let me start slowly. Let me build this up and see if it takes me somewhere. And branding yourself, giving yourself a website, putting yourself out there, I think is really, really difficult. But the moment you have gotten past that uncomfortable stage, then I knew that I wanted my brand to succeed.
Yes, and this is the aspect that I would want you to, talk in detail. That one was branding yourself and then putting yourself out there, building a website. How did you go about it? You coming from a medic background, website is something technical. Do you outsource it? Did you take your husband's help? Or, how did you go about that?
My husband did my website.
Okay.
So I sat with him. A patient who comes to me will be speaking to me about their concern. They might have a wrinkle, or they may have acne scarring, or they may have pigmentation. So we set the website up so that there's a concerns page. So you go onto the concern and you find your concern. And then there's patients that look on Instagram and they see, a treatment that's advertised by someone. So then I have a treatment section. So someone who already knows the treatment can navigate into that section. So very much, we're updating the website all the time because aesthetic medicine isn't something that kind of has an end date. There is new advances in aesthetic medicine daily, and you have to stay on top of what you're offering to make sure that you're offering the best for your clients.
And how did you go about setting up the business? Like, one is acquisition of the client, people knowing Dr. Bansri exists, she does the so and so things in treatments. But then there's the operational part of it. How do you go about that? You have product lineups, you have, association with certain products. I'm sure there are many more which I'm not aware, but if you can speak about that.
So you start low and you start slow. At the beginning, it was very much ordering stock that you think that you would get through because everything has an expiry date. So you can't be ordering boxes and boxes of product. So that was very important. And I think I spent a lot more time on admin at the start because I was ordering as and when I needed 19, when I set up my clinic at home, I had 4 new patients. And so you can't plan for what they're going to need. You can very much just plan for the now. And as you start to grow, then you start stocking more product and stocking skincare and being, because someone might come in and book in last minute but also want a treatment tomorrow. So then you start looking at deals and offers and what's available. And if I saw that something was popular, I'd go on training for that. So setting up the business was the push that I needed to get me out there to do those things and to build my brand. And I think so I set up the website and I set up a Google business page, which I think has been really important in my growth, Instagram and Facebook. And all of those things and getting yourself out on the platforms, making people know that, just hear about you or be recommended is how I feel my business has grown.
So the initial investment which was required, of course, you were earning, so there was no problem per se. But did you think that it was too much or it was a manageable investment?
It was a manageable investment because I did it within my house. Because we converted our garage into a clinical room for me, it was actually adding value to the house. So, yeah, it was a really good stepping stone for me to be able to offer aesthetic treatments in a semi-clinical environment and to be able to grow.
And how do you work on building trust? Of course, good work, I get that. But one client comes, how does another client come? Besides, of course, your social network work, how do you offline work on it?
Trust comes with time. When a client has seen you and seen you a few times, and if you're honest and genuine about your recommendations, they will come back. It's not about lining your pockets with money. It's
Yes.
about giving them what they think, well, not what they think, what you think is the best treatment for them. It could be something unaffordable for them and for the moment, but they may come back because they appreciate that you have said no, sent them away, given them the treatment options that is going to give them a result, and then building on that.
Okay.
So building trust, I think, takes time. But I think if you're doing a genuine piece of work and you're giving a genuine consultation, that will grow naturally.
Okay. And if you can explain me what aesthetic medicines have to offer, like Botox, injectables, what all. So if anyone is aspiring to enter this field, what are those different aspects of aesthetic medicine are we looking at?
Oh, what are the treatments? So there are so many. So there's a whole field of injectable treatments, and then there's a whole field of non-injectable treatments. Non-injectable treatments are working on skin quality. So you can have something called microneedling, you can have something called radiofrequency microneedling, you can have chemical peels, you can have something called mesotherapy. These are all fields within aesthetic medicine, but doesn't always require you to have an injection. And the injectable sides is Botox, it's fillers, it's skin boosters like polynucleotides. It's the separate side of aesthetic medicine where you can achieve a result by injecting into someone's skin.
Okay. And with this field where you've set up your own business, I'm assuming that you have more time to spend with your family and kids.
Absolutely.
Yeah. And it gives you that kind of flexibility to, prioritize other things if required.
That was probably one of the leading reasons why I wanted to set up by myself. I want to be around for my kids. I want to see them grow. I want to be around when they're doing their homework. So a typical working day for me is working between 9 to 4 o'clock. And I do one evening every week and I work a Saturday morning. And that's given me the flexibility. I think working for yourself, I have that flexibility to make sure that I go to all their school events and go to their assemblies. And between me and my husband, at least one of us are there.
That's brilliant. And was it difficult at any point when you were embarking into this? Any time that was challenging, you felt that, "Oh, did I do the right thing?"
I actually haven't had very many doubts about aesthetic medicine. I've very much grown with the field. And I think that year in hospital where I worked as a maxillofacial SHO has given me that wider variety of treatments. And I think that's helped me be confident as an injector. I wouldn't say I've had that many challenges. I think, building the business and the admin side can be challenging,
Okay,
but not the clinical side.
that's perfect. What was your most rewarding part till now in your business?
I get patients that I start prepping, a year before their wedding, and I do different treatments to work on skin quality so that their makeup sits well, or do an injectable treatment. And I get a message on the day of their wedding to show me what they look like as a bride. I think I've always wanted that validation. I wanted to make a difference. And actually in dentistry, I felt that I wasn't always validated. You might spend 2 hours doing a root canal treatment and you look at the x-ray and you think, this is great. You've done a great job. But the patient has got the fear of coming to the dentist. They don't want an injection in their mouth. They don't want to have a rubber dam is like something that isolates the tooth, and they don't want to sit there for an hour and a half for having a root treatment. So they zoom out the door.
Yeah, yeah.
But aesthetic clients are very different. They come and they sit and talk to you, and it's very much, part injecting, part counseling. And I feel that I have been able to get that rapport with the patient and build that trust by just speaking to them.
Mhm.
Very found that I've had more rewarding moments as an aesthetic practitioner than I have as a dentist.
And how do you keep up to date with, the latest in the field?
There's so many conferences throughout the year, so I tend to go to at least one of the conferences. You have magazines that come through your door every month, so you're flicking through and having a look to see what's out there. The different companies that you work with send you information, send you text messages or WhatsApp messages about different treatments, so you can't not go away and have a bit of a read about what is out there. You look at other clinics within the UK, you follow them and see what they're doing and the results that they have had. And
Okay.
that's been massive for my growth.
And you briefly mentioned that, you work with certain companies. Now, these companies, how do you get into partnerships with them? How do you crack a deal with them?
So once you start, buying or purchasing a product from a company, they will have you on their list of clinics that buy their products. So they come and meet you at the clinic. They come and talk to you. They tell you, we've got this product coming out and this is what it can do. So a lot of that initial education is from a rep, and then you build your relationship with the rep. You might go to a conference and you'll see the rep again, and they might have, a KOL, so an injector who is showcasing their results using that product. And like that one scenario, there are so many because there's so many different products and so many different companies working with them.
Perfect. I see you quite active on the social network with your company's promotion and the aspects that you want to showcase from your treatments. How do you manage time for that besides working?
I don't. I've for. It's very hard to put your face on social media all the time, but that's what builds your credibility. And it is very, very important to get onto social media, but finding the time is very hard. If you speak to my friends, you'll hear them. I'll be complaining or I'll make a mistake when I'm editing and, have to do the whole thing again. That part is definitely something that I would like to outsource. because I feel that they would probably do a better job than me.
I've seen quite a few of your reels and they're nice.
Thank
They're well
you.
edited. So yeah, at least I couldn't spot a problem there.
But yeah, very, very time consuming.
It is. It is a time consuming thing for sure. I mean, with my podcast, I know that when I record, recording is the easiest part of it. Then comes the most difficult part because editing takes time and you have to showcase everything that the guest has spoken in the right light. And yeah, so I totally get that. Takes time. Well, it's the end of our conversation about your career, but it's not the end of the podcast yet. I have a few questions which may fill in a few things that we might have missed during our conversation. So, if I have to take you back uh, in your early 20s or late teens, would you still have the same career path or would you have done something different?
I think I would have done the same. I've always wanted to be in a patient facing clinical environment. And although I am not in a clinical setting in a dental practice, I'm still in a clinical setting, patient facing, but treating patients in an aesthetic environment. And I feel that my dental background has given me the confidence that I have needed in aesthetic medicine. So I would do it all over again.
What do you think you would have liked to hear when you were a 20-year-old? Like any advice? Had I known this better when I was 20, I would have done things a little different.
I would say that don't let university define you. Don't let your course define you. I went to dental school to become a dentist, a tooth doctor, and yet I have used that and navigated life in a completely different path. You know, I felt that maybe as a 20-year-old, I kind of had tunnel vision of where I wanted to go, but my path has gone a different way.
Okay. I'll put you in a spot. Dentistry or aesthetic medicine?
Difficult question.
Mhm.
As it stands right now, I would choose aesthetic medicine.
Yeah, I thought so. What's the most rewarding part of your entire career? A patient, feedback, anything?
I think in both jobs, just someone who is just grateful for something that you've done. I've felt that gratefulness in both jobs, whether, you know, it's an anxious patient, whether you have treated a disease, whether you have worked on a patient's aesthetic features, either way, just having that extreme patient satisfaction.
What would be So, according to you, what would be the most essential skill to have in dentistry and in aesthetic medicine?
Great communication skills, being able to empathize, great manual dexterity.
Some lighter questions. What is that one book that you think you would recommend to anyone? Nothing to do with dentistry.
I'm currently reading a book that has really inspired me. It's The Diary of a CEO by Stephen Bartlett.
Yeah. Okay. And what is it that you like about it?
I like how it puts you out of the box that you're in so that you can move forward and right and left without fear.
One thing that you think every young professional should know if they're aspiring, like in your case, we have two professions. So I'll ask for dentistry as well as aesthetic medicine. Okay.
Dental school is not easy. It's 5 years. You get 4 weeks of a break in between every year. It's a challenging course, but really, really worthwhile.
And are there any dropouts? Like when you were studying, were there any dropouts then?
I would say there was probably around 15 to 18 that we lost from first year. And I think we probably lost them in the first 2 years of dental school.
It's that difficult then. Quite a few.
I don't know whether they found it difficult or whether the clinical environment was not rewarding for them. I'm not sure, but yeah, it is challenging.
It's challenging. No, that's quite a clear uh, direction for people to think about and figure out more before entering into
Absolutely.
university of where they are taught dentistry. So yes, that's important information. One moment in your career that you'll never forget.
Good question. I remember one time where I was treating a frightened child. I'd seen him several times, but he wouldn't have a treatment with me. And one day he came in and completed a filling with me, had a local anesthetic, sat holding the chair as if he was going to fly off the chair. And I think that moment will always sit with me, that he sat through, he had the treatment, and that bravery and courage for someone so little. He had tears in his eyes. I saw his mum had tears in his eyes, and I also had tears in my eyes when I completed the treatment. So that personal satisfaction when you've done something to really help someone.
It's emotional. That's emotional. And were there such many moments where you were moved by a patient or their pain or, the treatment that you provided them?
Absolutely. Yeah. Yeah. Dentistry was challenging, but there were many rewards in dentistry as well.
It's beautiful to hear about these stories because this is what we are looking at, right? The satisfaction of doing your work is mostly from those softer emotions rather than anything else. So it's so beautiful. What is your guilty pleasure after a long day?
A cup of tea and Netflix.
Okay. I think Netflix has become guilty pleasure of many of us.
Definitely.
What is the most misunderstood thing about dentistry and aesthetic medicine?
With aesthetic medicine, definitely, that aesthetics equals fake frozen faces. Good work is undetected.
Okay.
Dentistry, I feel like there is a bit of a misconception with that. Dentists, a lot of money, and they don't realize how difficult it is behind the scenes. I think, people just think it's a great career, that there's lots of money in it, but actually there's a lot of hard work that goes into being a dentist.
Thanks for clarifying that. A quote or a mantra that you live by?
Don't let anything bring you down. Pick yourself up and keep going. And my previous experience at a young age has taught me that failing is not an option.
Have you given it a thought that AI at any point is going to intermingle with your profession?
A little bit, yes. AI is already doing, facial scanning and consultations. So it may be able to help with, facial mapping and aging the face and some treatment planning, but the physical touch and assessing someone's, skin laxity can only really be done by touch. So to an extent it may help, but it can't take over. Thank God.
Thank you. Thank you so much, Bansri. It was such a pleasure talking to you and to know about two professions in quite a bit of detail. And I personally have learned a lot about dentistry and aesthetic medicine from you today. Of course, at a superficial level, enough for me to, if I'm interested in either one of them, I can go dig them further. And I so hope that any listeners who would want to make a decision in either of these professions would know whatever you have spoken about as a knowledge and then do their own research and digging. So it was wonderful having you here, Pansri.
Amazing. Thank you. Thank you for having me.
This was a conversation with someone with so much clarity, from the intensity of dental school and years in clinical practice to building a career in aesthetic medicine on her own terms. If there's one takeaway in this, your first career choice doesn't have to be your only one. What matters is understanding your strengths, staying open to change, and having the courage to evolve. If this episode gave you the clarity, share it with at least one person who might benefit from it. And don't forget to subscribe to this channel, where real professionals share the good, the bad, and the reality behind every career. Until next time, keep exploring and keep unblurring your path.